Hello, my seventh graders. This is going to be our very first video lesson. We are going to be picking up where we left off. The last couple assignments I've posted on Google Classroom have had to do with you learning about the warning signs of mental or emotional illnesses. Today, we're going to start talking about some of them. The first one that we're going to talk about is anxiety. Uh, Stop and think to yourself, what is anxiety? I know we're familiar with this word. I'm going to give you a couple seconds to think about it. When I think anxiety, I think of nervous, nervous to do different kinds of things that most people normally wouldn't feel nervous to do. It says an anxiety, and I'm just going to be pointing to the words that I'm reading so you can follow along. An anxiety disorder is a disorder in which intense anxiety or fear keeps a person from functioning normally. The fear and anxiety can cause significant problems in areas of their life, such as social interactions, school, and work. So I want to tell you guys a little bit, and girls, I'm sorry. That's a habit I'm trying to fix. I always say, okay, guys, but I don't mean guys. I just mean people. So, all right, everybody, story time. I have a very good friend who actually suffers. I have a couple friends that have to deal with anxiety on a daily basis. And their anxiety comes from a lot of different things. I have a very good friend who has not yet told his parents that he's gay. He's nervous to talk to them about it. I know his parents, I know everything would be okay, but he hasn't felt that there's a time to tell them or a place to tell them. And he's just nervous about how things are going to turn out. That gives him anxiety. He will sometimes start to feel lightheaded. His heart rate will increase. He will start feeling kind of sick, and that's how his body shows its nervous feelings or fear. I have another friend who has anxiety, and there's times where she will call me and say, "Hey, can you come with me to go to Rite Aid?" She's like, "I'm just feeling really nervous right now and really anxious." And I'm like, "Yeah." So this happens to her a lot during the week, and sometimes it can keep her from actually leaving the house. And so that's two different examples of how anxiety can cause problems in your life, social interactions, school, work. Another thing is, to get a job, you have to go through a job interview. And going through a job interview is nervous. You feel nervous. Everybody's going to feel it. But someone with an anxiety, their fear might increase to a level where they can't even go to that interview because they're so nervous and scared. Will they die if they go to that interview? No. But that's how intense the feeling of anxiety can be. Some different examples of anxiety disorders are panic attack. So, a panic attack is in reaction to extreme anxiety, unexpected and repeated episodes of intense fear, accompanied by physical symptoms such include chest pain, heart palpitations, shortness of breath, dizziness, or abdominal distress. Sometimes I feel like those are some symptoms that my friend has. The one who's kind of nervous to come out to his parents. Another anxiety disorder that I think many of you have heard of is post-traumatic stress disorder, PTSD. PTSD is an anxiety disorder that can develop after exposure to a terrifying event or ordeal in which grave physical harm occurred or was threatened. Traumatic events that may trigger PTSD include violent personal assaults, natural or human-caused disasters, accidents, or military combat. A lot of times, like, obviously I wasn't alive during the Vietnam War. I'm not that old. Um, but I've heard so many stories about people going off to fight in the Vietnam War and then coming back with PTSD. Or even going to Iraq, which is a recent war that you might have heard of. People who are out there on those front military lines often come back to their home environments, thinking a little bit differently and feeling differently. So they have to go through and work through these emotions, often in counseling, or there's different ways, and we're going to talk about those different ways in later, okay? But another PTSD, so the post-traumatic stress disorder. So post, this word means after. So an after traumatic event. So another traumatic event that is unfortunately very common is rape. People are sexually assaulted. Children, teens, adults, people of all ages, and that can cause trauma to their lives that could then lead to them having this this stress disorder. It's unbelievable sometimes how our body reacts to life around us. I'm sorry, my dogs are about to bark right now. I can hear them. Okay, let's keep going. Panic attack. Here's a video about panic attacks. Let's watch it together.
I'm sure you've heard someone say or joke about having a panic attack, but panic attacks are very real situations where someone has a sudden period of intense fear or discomfort that something bad's going to happen, and that there's some imminent threat or danger. These feelings are often so intense that they're accompanied by physiological symptoms like heart palpitations, dizziness, or shortness of breath. These symptoms peak within the first 10 to 20 minutes, but some might last hours. Sometimes patients having a panic attack might feel as though they're having a heart attack or some other life-threatening illness. Panic attacks can happen even in familiar places where there are no real threats, and therefore they're unpredictable, which can further increase anxiety about when the next panic attack is going to happen. In order to be characterized as a panic attack, though, the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or the DSM-5, says patients need to have an abrupt onset of 4 of the following 13 symptoms: pounding heart or fast heart rate, chest pain or discomfort, sweating, trembling, shortness of breath, nausea, dizziness, chills, numbness, feelings of choking, feelings of being detached from oneself, fears of losing control, and fears of dying. Admittedly, some of these symptoms might naturally happen together, and so they can be very hard to tease apart. For example, it'd be unusual for a person that's sweating, feeling dizzy, and feeling chills to also not be trembling. It's also important to note that some of these are physical symptoms, whereas others are specific thoughts or ideas. Panic attacks can happen in the context of several mental disorders, including depressive disorders, post-traumatic stress disorder, and substance abuse disorders. It can also, however, happen in the context of a panic disorder, which is basically defined by the panic attacks being recurrent, meaning 2 or more, and unexpected. In addition, the DSM-5 says that for somebody to be diagnosed with a panic disorder, they also need to have persistent worry or change in behavior because of their panic attacks. Also, the panic attacks can't be due to the effects of some substance, like an illicit drug or medication. Finally, the panic attacks aren't better explained by some other anxiety disorder, like agoraphobia or social anxiety disorder. Patients with a panic disorder can't predict where the panic attack will happen next, so it's important to get treated before patients develop something called avoidance, which is when they actively avoid the places where one previously happened. They might stop doing activities that they think might trigger the attacks, like going to the park, riding in elevators, or driving. Avoiding these situations might temporarily reduce symptoms of anxiety about having a panic attack, but it makes daily life really tough, right? And ultimately doesn't stop the attacks from happening. Sometimes patients get anxiety just thinking about the possibility of having a panic attack, and this is called anticipatory anxiety. And this can be particularly debilitating because it might cause the patient to be reclusive and choose to endure the attacks alone instead of risking an attack in public. This situation can actually lead to the development of agoraphobia, a fear of going into crowded spaces. Panic disorder is twice as common among women as men, and it appears to have a genetic component and run in families, although we don't exactly know what causes it. Treating someone with panic disorder usually involves psychotherapy, medication, or both. Cognitive behavior therapy has been an effective type of psychotherapy for patients with panic disorder, and this relies on 5 fundamental steps. First, they just learn about the panic disorder and how to identify certain symptoms. Second, they monitor their panic attacks using a diary. Third, they work on breathing and relaxation techniques. Fourth, they start rethinking and changing their beliefs about the severity of a panic attack from totally catastrophic to a realistic level. And fifth, they allow themselves to be exposed to situations that provoke fear and anxiety. Now, if medications are used, antidepressants like SSRIs are the most commonly prescribed, which have sedative and relaxing effects. Anti-anxiety medications might also be prescribed, like benzodiazepines, which also have a relaxing effect, although the use of anti-anxiety medications can sometimes lead to unwanted side effects like tolerance, dependence, and withdrawal. If very severe, anti-seizure medication may sometimes be prescribed. Overall, though, between cognitive behavior therapy and medication, many patients can be effectively treated for panic disorder.
All right, we're going to stop there on that video. I thought that video was very informative and it covers a lot. And so you can see here, if you're curious about other things, let your curiosity go. Let it wander. Click on some of these other things. Now I have another video of PTSD. So we first learned about panic attacks. Now we're learning about PTSD. And if we go back, these fall under the category of anxiety disorders.
Holy, there's a group of people coming to kill all of us right now. First time I got woken up by mortars. Frightening. Racked back my rifle, started scoping in on me with Kevlar shrapnel. I got discharged for having PTSD. A lot of anger. The kind of anger where somebody does something stupid on the freeway and you want to chase them down. It's all because of everything I went through. Yeah, I was just a really happy kid. I had a goal to be like that again. And that's when I started to actually want to go to therapy to try to get that back.
When we kind of ignite the memory, we are not in those memories. We are just kind of looking at them from a distance. As always, you're in control of this.
The number of veterans that are needing help and the amount of people that are available to take care of them has just not been sufficient.
What comes up for you when you think of that memory?
Helplessness. There was nothing anyone could do to help anybody. It's like the feeling of driving through a freaking dust storm.
When we're talking about post-traumatic stress disorder, essentially what's happening in our body is a fight, flight, freeze response. Folks that are experiencing PTSD are constantly in that level of survival store.
Carnage comes into mind straight away. I've had people in my sights before. We were just on edge.
Hold on. We want to have a foot in the present at all times.
What we don't want folks to do when we're talking about traumatic memory is to get consumed by those memories and feel like they're reliving them.
Okay, great.
We want them in the present, and that's essential to doing this work. And we use tactile therapy in somebody's hands as a way of keeping them present.
If people live many years with untreated PTSD, they're more likely to develop heart disease, stroke. So it's a very risky business to not seek treatment for PTSD in terms of long-term health consequences.
Having PTSD, it's not just a symptom, it's all-encompassing. And it comes at you from every corner all the time, so you have to build the skills to hold things back until you can find a way to turn them around and push them the other direction.
We are victims of our traumatic experience. Nobody chooses it. Even if choices led us there, nobody chooses to be traumatized.
Deep breath. Good job. You know, you started with that word helpless and you moved into control. Just notice that.
Yeah. That's a good evolution.
I'm seeing him believe that he's capable, believing that he can do it. His life has shifted. He has gotten married.
It means so much to not have the person you love think they're a failure because of something that they can't control.
I don't think I would have been able to handle anything without seeing Ryan and going to Sharp. Yeah, it definitely saved my life.
Seeing Brandon really start living and being able to feel like he can leave therapy. How can you not smile about that?
It's amazing what this has done for him.
I'll say, knowing that you can beat PTSD, it's powerful.
Begin your SHARP experience by choosing a doctor. Call 1-800-82-SHARP or visit sharp.com.
I also really liked this video because it kind of paints a whole picture of what causes PTSD. And then you can see in real life how it affects people and the treatment. And then you can see the relationship that this person has with another person and how, they work through this together. And it's very important. I am going to stop. Oh, we have a couple more that I will talk about next. I'm going to stop the video here. After this video, there's going to be a couple questions for you to answer. Tomorrow, that we will keep going on a new video. I hope you guys are doing well. Stay tuned and have a good rest of your day.